Hello, I'm Bing Gong and I'm with West Marin Standing Together, and our healthcare committee is sponsoring a town hall meeting with our Congressman Jared Huffman. Event is going to be next Friday, September 15th, and it's going to be at the West Marin School.
And Dennis Rodoni's going to be there too.
That's right, and I'm here with two of the participants, Liza Goldblatt, who will be our moderator, and Judy Spelman, who is a Medicare for All advocate.
I'm Liza Goldblatt, and as Bing said, I'm going to be the moderator of the upcoming event here in Point Reyes, where we'll be having our Congressman Jared Huffman, our supervisor Dennis Rodoni, Judy Spelman, as Bing said, who's for Medicare for All, and Ellen Karel, who's vice chair of Healthcare for All here in California and supporting the most current single-payer bill. And we're very pleased that we're about to hold this town hall, because one of the elements we've realized that could be very beneficial for all of us is to bring people up to date on what's going on nationally, statewide, and locally, because healthcare affects all of us. It crosses all socioeconomic levels, and it's a rather complicated situation these days, and in fact it tends to be changing every day. So I'll pause for a moment, and in a moment I will go through the actual format of the evening, but for now I'm going to pass it on to my colleague Judy Spelman.
Good evening, I guess. It's evening. My name is Judy Spelman. I'm a local Inverness resident and I'm a nurse. Worked in Marin County for about 30-something years as a nurse, and actually met many of you through my nursing career. And I've also been involved in writing health policy, and I spent about 8 years in Sacramento writing single-payer plans for the state of California, but now I think that we should prioritize Medicare for All, and one of the things we'll talk about on the 15th is why choose to organize for Medicare for All versus organizing for a state-based single-payer plan. And we'll talk a little bit about what single-payer is, why, in my view, for example, Medicare as it stands now is actually not a single-payer plan, but how it could be, and it would be probably a lot better plan if it were. And I think the pros and cons of building a national movement for health reform versus building a state movement. We'll also get some update probably from Dennis Rodoni about how our local clinics in Bow and here in Point Reyes and in Stinson are affected by the so-called politics of healthcare in Washington, D.C., which is hard to grace with the name politics, but how the Republican approach to health reform could well affect our local clinics. I think it'll be useful to everybody to have an update on that, because it may determine, to some extent, or help people decide where they might want to put their time and energy.
Another element that we'll be talking about, while we'll focus very extensively on the entire healthcare situation, we're going to spend about at least the first half and maybe 3/4 of the event talking about the various areas of healthcare and how indeed they all interact, from the local to the state to the national situation. But one of the things we will do towards the end of the event is also open it up for more general discussion and general questions. So one thing we would like to ask all of you to do is come in with questions that you might have. There's a lot of terminology used in healthcare. We will have a cheat sheet available to people about what certain terms mean, and people actually use them in various ways. And then we'll also open it up when we're done with the healthcare discussion, as I said, if people have questions about other things that are going on locally, which impacts all of our lives. And Dennis will talk a little bit about what's going on in our local healthcare situation, but other local issues that are going on and maybe statewide. And we've also asked Congressman Huffman to talk about not only what's going on nationally, but also some of his views and his visions of how we might move forward, specifically in healthcare and other areas. Many areas that are now being discussed in DC are impacting us locally. It might be immigration, it might be issues around the environment. So we're not going to restrict it to healthcare, but at least 60 or 70% of our time will be spent on healthcare. So think about your questions, write them down. You can send them to Bing now if you want. And Bing, your email address is?
binggong@sonic.net.
You could include it in the email this is going to
Yes, I will.
Right.
The only thing that I would add is that it seems to me like this is a very interesting moment and a big opportunity for major health reform, whether it's at the national or state level, because of the Republican fiasco in their failure to, promising to repeal and replace and failing to do so. They started out with a big idea. They failed, but they opened up health reform, I think, to other big ideas like Medicare for all or a state single payer system. And I think if the people in this country could, if the people in this country could pull it together and create a strong national or a strong state movement, I think there's a realistic opportunity to win a major reform. And that's one of the reasons I think we wanted to have this community meeting, that to be sure that everyone understands this opportunity in this political moment.
And we'll also be talking about how people can become involved. A plus side of what's going on is, to my knowledge, for the first time in a sense in many decades, the vast majority of Americans are now really believing that healthcare should be accessible for all. It's very interesting to note when you look at the world that it used to only be the United States and South Africa that did not have healthcare for all in the so-called industrialized world. It's now only the United States. So I think another element is to offer some education on what's going on around the rest of the world, because virtually in all other industrialized countries, there is some form of healthcare for all. I should mention that I work in integrative medicine and health education, and I go back to Washington, D.C. several times a year, where we're focusing intensely on how do we reform healthcare education so it focuses on collaborative, team-based approaches that also really emphasize disease prevention, health, and well-being. Because fundamentally, we're in a fractionalized, disease-based healthcare system with tremendous for-profit motives. So we have to also really look at not just healthcare reform and how it's offered, but how are we educating our future healthcare professionals? So that's another area of emphasis that we'll be talking about. And there's great movement forward. There's a very much a consensus with most of the educators involved in all the health professionals now that we must begin to shift towards issues that I just mentioned about disease prevention, about health and well-being, and not just lip service, but really actually stressing it and holding courses on it. About 75 to 80% of the reasons people come in to see their health professionals are actually for preventable conditions and diseases. So it's a complicated issue. It's not just individual issues, it's an entire systems-based issue. If you're working 2 jobs, when are you going to have time to exercise and eat appropriately? So we really have a large, complicated problem, but I think, as Judy is saying, we have an incredible opportunity here. We could actually flip it from a medical industry to truly a healthcare system for all.
Thank you, Liza Goldblatt, our moderator,
It's going to edit it.
and Judy Spelman. Thank you.
Thank you.